Want to welcome everybody for the next segment. Again, I'm Dr. John McClanahan, and as before, I'm still a grateful recovering alcoholic, and want to thank everybody for being here for this segment and this series on medical aspects. I had mentioned when we did the first segment that when we talk about this particular topic, we're looking at the effects of use on the body. We're not talking about late stage addiction, late stage anything, just the effects. I had mentioned in the first segment that if addiction is an issue in your situation, what you can do is take what we talk about and multiply it times 10, times 100, times 1,000. So again, we're not talking about late stage anything. We're just talking about use, or a couple of drinks too many, a couple pills too many, whatever that might be. And I know that's kind of a moving target and a random term, but anyway, we're going to do a second piece of what we started off with, and just want to do a little brief overview. We had talked about one of the things that I think people need to understand, and you'll really see this play out in this segment. There's three basic properties that all drugs of choice have. First thing they do when they come in contact with the body is they irritate what they come in contact with. Again, I'd used as an example in the first segment that person takes their first swallow, their first drink, and it burns on the way down. It's irritating the nerve endings in our throat, our esophagus, and our food pipe, and then ultimately in our stomach. Well, all drugs of choice irritate what they come in contact with. Eventually, two properties kick in depending on whether we're talking about a depressant or a stimulant. If it's a depressant like alcohol or an opiate, heroin or prescription medication, painkillers, that type of thing, then eventually it starts to sedate what it comes in contact with. If it's a stimulant like cocaine or amphetamines, it hyperstimulates what it comes in contact with. So it's kind of this sensory overload. The end result, if we keep doing that over and over and over again, eventually it kills what it comes in contact with. Okay, so we went through some of that. We talked also about alcohol having a kind of a fourth property. It's kind of a dual personality type of thing. Alcohol is certainly a depressant, and it irritates, sedates, and then eventually kills. But it's also a food. And we talked about in the last segment that it's been called the perfect food because it's already in its pure usable form. Your body doesn't have to digest it and that type of thing. We went through that in the previous segment. Well, where we kind of left off with that is I want to take you on kind of a little trip here with, you can use your imagination with this. And again, like I said, I kind of have a fun way of doing this. I've been doing this a long, long time, and I know for most people, when you hear medical aspects, the first thing you think back to is maybe 10th grade biology or something, and your eyes roll back in your head, and it's like, this is going to be, not to be right, I used to have a friend who used to talk about this. I know for a lot of people, medical aspects can be as dry as a popcorn fart. I mean, it's just, it's like, is that all there is? Well, I try to make it a little bit more exciting and interesting. So we have a little audience participation to do here in a minute, and you'll certainly see that here in a few. Well, where we left off again was, I said, I want you to take a group of normal cells, just a bunch of normal little guys. They can be brain cells, they could be skin cells, they could be heart muscle cells, they could be liver cells. Got a whole cluster of these normal guys, and the cell is made up of a lot of different pieces. Two pieces are very important for what we're going to look at in this segment. First of all, we're going to talk about the nucleus of the cell, and then we're going to talk about the cell wall. The nucleus of the cell, again, like I mentioned in the last segment, is kind of the brain of the cell. It tells the cell what to do, when to do it, when to stop it. It tells the cell what kind of cell it is. And all that memory is carried over when cells replicate and reproduce. So heart muscle cells don't automatically or just magically turn into stomach lining cells and that kind of thing. So the nucleus is the brain of the cell. The cell wall is important because that's what keeps everything together. That's kind of the fence that keeps, the glue that keeps it all together. You'll see in a minute why that's important for this segment. One of the things that I had mentioned, that one of the first things that gets kind of knocked offline through active use, and again, we're not talking about late stage addiction, okay? First part of the cell that starts to get dialed down is the nucleus of the cell. So very quickly, the cell starts to lose some of its ability to know what it is, what it's supposed to do, when it does it, when it stops doing it. Okay? And I had put up here a little example of kind of an enlarged view or version of a cell. One of the things a cell has to know how to do is take out the trash. Okay? I mentioned this in the last, but I want to go through that again just to make sure that people understand that, because that's the basis of everything else we're going to look at here in a minute. The cell has to know how to take out the trash, like I said, and we have a name for that. There's a term that we use for that. It's called homeostasis. And basically homeostasis means balance. Everybody in here is homeostatic. And I hope you stay that way for a long, long time. Every time you breathe in oxygen. When you breathe out, you exhale carbon dioxide. That's homeostasis. It's in with the good, out with the bad. Every time your heart beats, that's pumping oxygenated blood, bringing back blood that's oxygen depleted. That's homeostasis. You'll see another version of this here at the very end, of a condition where homeostasis is way out of control, and you can see it visually in the individual. So anyway, the cell has to know how to take out the trash. Now what we're going to do in this little episode here, I had mentioned in the first segment that one of the jobs that I had years and years ago, and I love doing this, I love what I do now, but this was such a unique opportunity. Back in the mid-'80s and into the early '90s, I was a director of a hospital-based program, but I also had another kind of a part-time job when I wasn't at the hospital. I was the principal lecturer in substance abuse at the National Museum of Health and Medicine, and I really, really enjoyed that job. That was just such a unique opportunity. And I would do 2 lectures a day. I'd do a 9 o'clock and an 11 o'clock. And what was so unique about that is my 9 o'clock might be 4th grade science students that were maybe doing a segment on drug abuse or something. My 11 o'clock might be 3rd year medical students. So you had such a wide range of experience and knowledge and desire and motivation and that. Well, with the kids, I found out I had to come up with some other examples to get points across for a lot of reasons. First of all, they didn't have the experience maybe that some of the adult groups had. And you also had to keep their attention. I'd mentioned in the first segment also, you can think back, and you probably had this situation too. There is nothing worse than going to school and you're going on a field trip, and you're so excited, you're going to go somewhere, you're going to do something, and then you show up somewhere and you got to learn. It's like that just kind of defeats the whole purpose of the field trip. So I had to try to keep it exciting and that kind of thing. So I'd come up with these really kind of wacky examples and comparisons that the kids could relate to. And then I found out over the years that the adults could relate to it as well. So a lot of the examples that I would use with the 4th and 5th graders found its way into treatment groups and, adult education groups and that kind of thing. Because again, we're all kids at heart, and we like to have I think a lot of us learn better if we have a good time doing it. And I came up with this way. I asked the kids, if one of your jobs is to take out the trash and you forget to do it, and maybe you forget to do it for days and days and days and days, or you forget how to do it, what happens? And I tell them, I don't mean you get in trouble, you get grounded, you lose your... What happens to the trash? Where does it go? And they said, well, I guess it really doesn't go anywhere. Well, what happens then? Well, I'm adding more to the pile, and it gets bigger and bigger, to where eventually, if I kept doing that, we might have to move out of the house. It would just take over the whole house. I said, now keep that thought in mind. When homeostasis doesn't work, or it's being dialed down or being compromised, where does the trash go? And what I started doing, and this is kind of a bizarre example, but we'll have some fun with this. Okay? I want to give everybody, just grab a balloon. Okay? And I don't want anybody to panic. These are brand new. This isn't left over from the last group that did these, or this is all fresh, new stuff. You know, spare no expenses here. So I would tell the kids I want everybody to take a balloon. Okay? Well, now it kind of piqued their interest a little bit because, well, if I got to learn something, at least I got a balloon out of the deal here. And I would tell them, now, what I want you to do, I want you to pretend that balloon is a cell. Okay? It's a liver cell, a heart muscle cell, whatever kind of cell you want it to be. Okay? For our purposes, I want you to pretend that this is a liver cell. Okay? Now, as we go through this stuff, one of the things you're going to see, all drugs of choice have a property that's called an affinity. And basically, an affinity means it likes something. It's attracted to something. Alcohol has a couple of affinities. It likes the liver, it likes the pancreas, and it likes the brain. Not that other organs aren't affected, but a lot of the attraction, and it's like a magnet, a lot of the damage is done in those three areas. If cocaine happens to be the person's drug of choice, or in the mix, cocaine has an affinity for heart muscle tissue. It really attaches and likes that. Anything that you smoke, in nicotine, marijuana, crack in a way, has an affinity to lung tissue. Okay? It has more of an effect and impact in that area. So all the stuff that we talk about as we kind of go through this little balloon example, you can use any drug of choice, any organ in the body. Okay? Same principle applies. Okay? Now, what I would tell the kids to do, we got a whole bunch of these normal little guys here. Okay? Every time I tell somebody, I want you to take a drink, okay, or whatever your drug of choice is, go ahead and take your first drink. I want you to put a breath of air into the balloon. Okay? Go ahead and take a drink. Now I can tell you the real reason. This was a test. Okay? Always somebody in there, the balloon's this big already. It's like, no. Okay? So now you see something that's changed, very obvious change. Okay? My balloon is still very elastic, very supple. I can push it around, stick my finger through it. I can, it's very, very malleable. Okay? Your balloon's taken on a little different characteristic. The pressure on the inside is starting to build up. But it's still not bad. I mean, it's the surface pressure and tension isn't all that bad yet, okay? But it's taken on a little different shape because the pressure on the inside is pushing to get out, okay? With cells, what we see, same type of thing. The trash can't go out. It can't go anywhere, so it starts to build up. Okay. We call this condition fatty. Okay, got a fatty liver, fatty heart muscle, fatty whatever it might be. Okay. This condition is very, very easy to kind of diagnose. To give you an example, now I can't do this anymore, so this is do as I say, not as I do. The liver is the largest organ in your body. I had somebody a number of years ago challenge me on that, and it's not the largest. It's the largest organ in your body. Your skin is your largest organ, but that covers your body. So the liver is the largest inside. Okay? It weighs between 3, 4, 5, 6 pounds, depending on the size of the person, and it's very conveniently located and protected right under your rib cage. Well, one way you can test to see if you have a fatty liver or a normal liver. Take 2 fingers. Maybe you've had this done in a doctor's office in a physical. Take 2 fingers, run down your breastbone, go over to the bottom of your rib cage, and you can take those 2 fingers and you can poke up under your rib cage, and you might feel a little kind of roll of not flab. I'm talking about me. I'm sorry. You might feel a little roll of skin or something that kind of feels a little unusual, but it's the tail of the liver, okay? I can't do that very well anymore because there's a whole lot more of me here to kind of poke through, so trust me. So now what you have is the liver is swollen a little bit. No real a lot of heavy social drinkers, when they stop drinking, have fatty livers. Again, it doesn't have to be a late stage addiction kind of thing, okay? I certainly, when I first got sober, this was there. Okay, I certainly had a fatty liver, and you can determine that by routine blood tests. Anybody that's ever had a liver enzyme panel done gives you kind of your scores and measures for different liver functions and that kind of thing, and that indicates whether you have a fatty liver or not. I would tell folks, now what I want you to do, take another drink. Go ahead and put another breath in the balloon. Okay. Okay. Now you have another very obvious difference. Okay. My balloon, still these normal guys, still, you spill it? It's very, very supple, very elastic, okay? Yours has taken on a completely different characteristic, okay? The inside pressure has expanded to a point now where with your first breath, where it was kind of the fatty balloon, okay? You could probably take your finger and poke it in the balloon and you know, not meet with a lot of resistance. Now, it started to expand even more, and it's very hard. It's very, you know, the outside is not as supple and elastic as it was, okay? So now what you have is the pressure starting to build up even more and more. You also have something that's a little different too. If I had asked you, depending on the color of your balloon, if I had asked you, maybe I had a handout, and I asked everybody, take your balloon, and I want you to read the paper, the handout, through your balloon, most of you would say, well, you're nuts. I can't see through this. Okay? If I ask you to do it now, you might be able to. Depending on the color of your balloon, the cell wall, the balloon wall, is getting so thin and so stretched out, almost becomes transparent. You can almost see through it. Okay? So here we have where the cells start to swell up even more, but because they're very taut, okay, they're very hard, now you have something completely different going on. Okay? Now you have a condition, it's called an itis. And an itis, basically, that just comes from a Latin word that means swollen, inflamed. Okay? So now, not only do you have a fatty liver or fatty heart muscle, now you have tissue that's inflamed. It's sore, it's swollen, it's painful. Okay? Everybody in here has some experience with some type of itis. Okay? If you ever had your tonsils out and you had tonsillitis, a swollen, inflamed appendix is appendicitis. If we're talking about cocaine use and we're talking about the affinity for heart muscle tissue, a painful, swollen heart muscle, that's called myocarditis. Okay? If you have a fatty, swollen, painful liver, that's called hepatitis. Okay? Now, hepatitis is a zillion, I love this. And again, I'm not making fun. Don't ever hear it that way. I've been doing this long enough that I remember we had two forms. You had hepatitis A and hepatitis B. And over the years, they discovered another strain of hepatitis. And we know it now as hepatitis C, but in somebody's infinite wisdom, it wasn't called hepatitis C. There's got to be an addict involved in this somewhere. Okay? It was called hepatitis not A, not C. Oh, not B, I mean. It's like, what the hell's that all? Why don't you just call it C? Not A, not B. It's like, okay, that's... And somebody finally decided, that's a little confusing. There's other letters in the alphabet. Well, we're up to hepatitis K now, where there's so many strains and versions. And hepatitis can be brought on by a virus. It can be brought on by an imbalance here. There's a strain of hepatitis that's brought on by deficiencies in a person's diet, certain minerals and nutrients that are missing. Okay? So many times people think hepatitis, they think, it's an IV drug use. Well, sometimes yes, sometimes no. It's a lot of different strains. But anyway, what you have here is now you've got a fatty, puffy liver, heart muscle, whatever it might be. And it's very inflamed. It's very painful. I used to do a lot of evaluations in the emergency room of the hospital that I worked in. And I would go downstairs to do the addiction evaluation to see if a person needed to come up to the inpatient unit and that type of thing. And a lot of times I'd go downstairs and the ER doc, he or she was still doing their initial physical exam. And I watched this happen a number of times, okay? Very often when patients would come into the hospital that had swollen, painful, fatty livers, they would come in complaining about having pneumonia. Okay? And they'd go into the hospital, they'd go into the triage nurse, and he or she would take their vital signs, ask them a couple of questions, and they'd say, well, I think I have pneumonia because every time I breathe in, it's like somebody stabbing me right here in the side. Well, if you've ever had pneumonia, you certainly know that can certainly be a symptom of it. Every time you breathe in, it's like your diaphragm's pinching something off, and it hurts. Well, they would do vital signs, realize the person wasn't running a fever, but they would, just to be safe, they would send them to X-ray, and X-rays would come back negative, no indication of any infection or that type of thing. And then they would start to ask the person about their eating habits, their drinking and other drug use habits. Okay, and they said, no, I'm fine. I've never met a meal I didn't like. Everything's good, that kind of thing. But every time I breathe in, what's that have to do with my eating habits? And I got pneumonia. And they would say, well, sir or ma'am, no, we don't think you do. We think something else is going on, but we'll wait for the physical exam. I saw this so many times, and this is one of those, and what did we learn from this moments? Okay. Doctor would go in, and he or she would have all the vitals, and the person's complaining about pneumonia, but they don't show any symptoms of that. Well, one of the other symptoms or illnesses that would show a symptom like that certainly is hepatitis, because your liver's tucked in right here. Okay, so now you've got a liver that's a little fatty, it's hanging out a little bit further than it normally would, and now it's painful. Okay, I have a favorite saying that I won't use on camera. I'll do a cleaned up version of it. You can't cram 10 pounds of stuff into a 5-pound bag. Well, when you have a fatty, swollen anything, you're cramming 10 pounds of something into a 5-pound bag. There's only so much room in there before something has to give. So now everything's expanding out. Everything is very taut and painful. Okay, I would see the ER doc say, okay, well, let me check something out here. He or she, usually he, would take 2 fingers, run down the person's breastbone, go over here to under their rib cage, take those 2 fingers and jab up under there, and you'd find out very quickly that the person had some kind of pain going on there, because the person would, I saw people scream, I saw people hit the doctor, just a reflex action kind of thing. Okay, I saw one guy And I'm sure he never did this again. Safety tip: if you're ever in a situation and you're doing that to somebody or somebody's doing it to you, just as a safety tip, tell them to move over to the side a little bit. This poor guy standing in front of the person does that and jams up under here. Just reflex action. That leg went up, kicked the ER doc right in the crotch, and they had to bring in his substitute, brought in a stunt double or something, to come in and finish up. You don't stand right in front of somebody but he wasn't thinking, and found out, it's like, oh, well, it might be hepatitis, as he. Now, again, the liver is fatty, inflamed, painful, okay? I would ask the kids, and I'll ask you the same thing, what happens if you keep adding trash to the cell? Can't take out the trash. What happens if you keep putting breaths of air into the balloon? Okay, absolutely. Sooner or later, that balloon's going to pop. Okay, we see that happen in this situation too. And I know I don't have to tell y'all, but I used to have to explain to the kids very often. Well, not that. I'm sorry. Cut. They would panic and they'd go, "The cells get that big?" It's like, no, they don't get that. It's just a example. Well, what eventually happens as the balloon gets bigger and bigger and bigger, sooner or later, the cell wall, the balloon wall, is going to collapse. It breaks, it pops. Okay? Same thing happens here. And whatever's in that cell, the trash that's in that cell, leaks out. Okay? Now, one of the things that happens when that occurs, okay, all the fluid, if there's infection there, you got a whole nother situation that can happen. That's another itis you might be familiar with. It's called peritonitis. Okay? All that leaks out into the abdominal cavity, and you got a whole different situation to deal with. Anyway, as your balloon popped, maybe you're sitting there and the tail end of the balloon still up at your lips, and part shot across the room, part hit your neighbor sitting next to you. Okay? You can collect the parts. You've got all the pieces of the balloon, but you can't staple it back together. You can't glue. It's never going to be a balloon again. You've got the pieces. You've got the cell wall, but it's never going to be a functioning balloon again. Same thing happens here. Cell wall ruptures. Everything in there comes out. Okay? The cell wall doesn't go anywhere. It stays there. You all know the law of physics about two things can't occupy the same space at the same time. This becomes dead area. Okay? Cell wall still occupying that space, but nothing's going to grow in that spot. You'll get new material around it. Okay? I used as an example in the last segment for the kids and to be able to get them to kind of relate to some of this. I use the example of, suppose you fall down on the playground at school, you fall off your bike, okay? And the school nurse or grandma or Aunt Tilly or somebody looks at your skinned elbow and says, "That looks pretty bad, we need to clean it up," okay? And we talked about the irritation. She rubs alcohol on it and it burns and that kind of thing because it's irritating what it's coming in contact with. Well, over time, what you're going to see, wherever that injury was, you're going to see nice new tissue, pink tissue growing around it, but nothing's going to grow in that spot. It forms a scar. Okay? So you got all this fresh stuff around here and this dead no man's land right here in that particular wound. We have that happen here. Okay? When these cell walls rupture and you have enough of them do that, what you get is scar tissue. And that's what cirrhosis is. Very often when we talk about cirrhosis, people immediately equate it with the liver. Well, cirrhosis technically is any scar tissue. Okay, if you've got, if you fell off your bike when you were in the 3rd grade and you've got a scar somewhere, that's cirrhosis, that's cirrhotic material. Okay, it's a dead area. Okay. The liver is, again, the largest organ in the body. It can take a lot of punishment. It's very resilient. Okay? In fact, we can destroy about 2/3 of our liver and still function. Quality of life isn't going to be what we'd like it to be, but we can function. We're going to talk about that in just a second. I'll show you a little chart with that. So here we have eventually what happens is these normal cells swell up and turn into fatty cells, turn into fatty, inflamed, painful cells. And eventually, if it continues on, just like the balloon, it's going to rupture, and now you've got that dead space. You've got that dead area that's nothing's going to grow in. Very often, I used to have the kids would ask me, and you can do this too if you want. They'd say, well, what happens if we stop drinking? What happens if the person stops using? What happens if they start eating right, or whatever's causing this mechanism to start? I'd tell them, take your balloon, okay, and what I want you to do is just let it go. And the kids would let it go, and they'd shoot all around the room. And I'd say, now, what you can do is you can take that balloon. I can't find, there it is. And it's going to look just like it looked when you started. This can revert to this. This can revert to this. This won't change. Once that's there, that's there. But like I said, you can destroy about 2/3 and still function. And in fact, we have kind of a chart or list that we go by. About 60-65% of the person's liver can be involved and still, like I said, function and that type of thing. When you start getting like critical mass, when you start to get a little bit over that, once you start getting into 70, 75, 80% of the person's liver is not functioning the way it should, that's called end-stage liver disease. When you start getting to 85, 90%, that's called end-stage liver failure. Okay, so we have it's a progressive thing along those lines as well. Once we've sustained some damage, and again, the liver, like I said, is very resilient. It'll bounce back. Nothing will grow in this area, but a lot of fresh tissue will grow around it and that type of thing. I want to show you one other little quick piece. Like I said, it's kind of a fun way to look at kind of how cells, expand and that kind of thing. And you get to keep the balloons too. So, go back to just taking a look at the liver itself. The liver is an absolute remarkable organ. I think it gets so much short shrift. Everybody talks about, well, the most important organ in the body is your brain. Well, the brain can't function without your heart. Well, neither one of them can function without your liver. Bless you. Okay, the liver is what actually controls most of homeostasis. It controls a lot of the balance. Producing enzymes, producing chemicals that are important to day-to-day health. It controls a lot of this. So yes, the heart's important, yes, the brain's important, but neither one of them could function very well at all without your liver. So I think it's probably a tie for first between the three of them, depending on how you look at it. But again, most people, when they look at the liver, first thing they think of is, well, it certainly can't do much of anything. And if you look at the human liver doesn't look any different than beef liver, calf liver. And it's one of those times I always tell people, if you can, liver and me just don't mix. But if you can stand that, if you slice the liver in half, if you do a little section, okay, it doesn't look any different than a piece of liver you'd buy at the grocery store. Okay. Healthy liver is a kind of a brick red, maroon color. Okay. It's got a healthy, this might sound disgusting to some people, it's got a very healthy smell. It's got a very healthy sheen. It's shiny. Okay? It has a rebound effect. If you take your finger and you push into it and let go, it'll spring right back. Not to sound real disgusting, but a healthy liver, you can tell if you've got a fish, a piece of fish, you can tell fresh fish from fish that's kind of gone south real quick. Fresh fish has a very nice shine to it, a healthy, clean smell. It's got resilience. You can poke it and it'll bounce right back. Fish that's kind of gone a day or two past its shelf life certainly doesn't have that shine. Stick your finger in it, it might go through. Okay, it's not a healthy looking situation. A healthy liver, again, you can tell the difference. In fact, a cirrhotic liver has a very unique look. Okay? I've seen cirrhotic livers in two different colors. Okay? One, very often, it'll be yellow because of the buildup of fatty deposits and scar tissue, which is a far cry from that maroon brick red color of that chair. Very dead looking, no shine to it. Or it can be green. And it's green from a buildup of bile and that type. We're going to talk about that here in a second. So you can tell the difference between a healthy and not so healthy liver. But again, a healthy liver, the human liver doesn't look any different than, again, what you would fry up with onions. If you look at a piece of liver, you look at it and think, well, this certainly can't do much because it looks like a piece of sponge. It's got a lot of holes in it where veins and stuff go through. It doesn't look like it would be worth much of anything. Okay? In actuality, the liver does about 5,000 things. For something that doesn't look like it does much, it's very, very busy. Okay? I don't care, and I don't mean this in a bad way, I don't care how busy, and I know we all are, I don't care how busy somebody is. You sit down one day and write down all the things you're responsible for at home, at work, at school, in the community, at church, whatever it might be. I guarantee you're not going to come close to 5,000 things. And we're absolutely exhausted. And folks are busy. Okay, so like I said, I'm not downplaying that. But the liver does about 5,000 different things. So for something that looks like it doesn't do much of anything, it's pretty important. Okay? The 5,000 functions that the liver provides can kind of be broken down, I think, into three categories. Okay? The liver is your body's built-in detox center. Okay? Spilled it again. So now you have, again, everything that goes into your body gets detoxed by the liver. Medication, vitamins. Okay? So it's your body's built-in detox center. It's also your body's built-in manufacturing plant. It produces a lot of chemicals and enzymes and substances that the body needs to function. Okay? Also has another function that's very unique. It's your body's built-in recycling center. Okay? So those thousands of things that the liver does can kind of be lumped into three sections, three categories. It's a detox center, it's a chemical manufacturing plant, and it's a recycling center. Okay? To give you an example of how, and all these are very important for homeostasis. Okay? To give you an example of homeostasis that maybe some of you have experienced, either firsthand or you've seen it or you certainly know about it. Like I said, homeostasis is all about taking out the trash. Okay? In with the good, out with the bad. Red blood cells live about 120 days, and then they lose their ability to carry oxygen, carry nutrients. Okay? They lose their ability to function as viable cells. Okay? And they die off. Well, that's okay, because bone marrow is where red blood cells are produced. And for every one that dies off, there's more being produced. So you've got that balance. If you happen to have more dying off than are being produced, you have a condition and situation that some people are familiar with. It's called anemia, where you just don't have the transportation system to get nutrients to where the body needs it because there's less cells being produced than are dying off. Okay? Well, part of homeostasis also, again, is getting rid of the trash. When those red blood cells die, there has to be somewhere for them to go. And the body's got a great mechanism to do that too. Where dead red blood cells go, the liver basically detoxes, pulls those red blood cells out of the system, recycles those red blood cells, and manufactures something that's very critical to digestion, and that's bile. Okay? And if you're not familiar, bile is very bitter. If you hunt, you certainly know one of the things that can destroy a good piece of meat. If you don't do it just right and you happen to nick the gall bladder and that kind of thing, it's all destroyed because it is extremely bitter. Well, the gall bladder is a little pouch that sits up under your liver, and it's a storage sac for bile. And as the stomach and digestive system needs it, it squirts out a little bit as you need. And for all that's used up, the liver's producing more, so you got a balance with that there too. When the liver is compromised and it can't do all these functions at the rate it normally would be working at, you get a very, very obvious situation start to happen. Where those dead red blood cells go, if the liver can't detoxify them and convert it into something else, where they go is nowhere. And they start to sludge up, just like sludge in a pipe, okay? Just like sewage in a pipe. They start to back up. And when they back up, it's very easy to tell that that's going on because the person's skin will take on kind of a yellowish cast. One way to certainly, because all of us, regardless of race and nationality and that type of thing, all of us have different skin tones. Might be a little more difficult to diagnose that color change in some people's skin, but you can certainly diagnose it in the whites of their eyes. No matter who you are, where you're from, what's your nationality, race, creed, all the above, the whites of our eyes are the same color. And everybody in here knows that old saying about the eyes are the window to the soul. Well, the eyes can be a real window to the body as well. When those red blood cells can't be converted and they sludge up and the body starts to take on that yellowish cast, that's what jaundice is. So jaundice is the end result of homeostasis gone bad. It's very easy to diagnose it because you can see it. The patient can see it. And of course you confirm it with lab tests and everything else. But usually you don't. You do it just as a backup to confirm it, but you certainly can see it. I've seen people with low levels of jaundice, just the beginnings of jaundice. And I've seen people in late stage liver failure that the jaundice is so advanced that their whole body, they look just like a yolk of an egg. I mean, they're just bright yellow. And it's very frightening to observe that. But again, when we take a look at these things, I mentioned in the very first segment, I don't do any of these as a scare tactic and that kind of, this is just kind of a nice to know for some people, need to know for some of us. Those of us, like I said, that recovery is an issue, we can use this as a great relapse prevention tool also. Because a lot of times people say, well, that didn't happen, and I'm one of those. Physically, I dodged the bullet. My liver enzymes were a little elevated and out of whack, but they kind of snapped back where they should be fairly quick. Physically, I was no worse for wear. Emotionally, I was a wreck. Spiritually, I was a wreck. Financially, I was a wreck. Relationship-wise. Physically, again, I cleaned up fairly quick and nice. Okay. These can be things that certainly can happen down the road if a person picks back up. And like I said, we're not talking about late stage use. This process starts with just casual, regular, like I mentioned in the segment we did on your brain on drugs, we talked a little bit about the difference is when that part, all those functions of the brain get dialed down through a couple of drinks, the next day, all those things dial right back up again. You get all those functions back. In addiction, what happens is the body never has a chance to repair itself because where this would convert back to this, well, if I'm still adding to the system, it's one step up, two steps back. One step up, 10 steps back. No steps up, 100 steps back. Before my body would have a chance to rebound and repair itself and recover, I was adding to the mix again. So I'm throwing gasoline on the fire. Okay? When we get to this situation here, people very often will ask, what happens if we get to that 66%? Or we start to get to 80%, and now we're talking about end-stage liver disease and that type of thing. The only, cure is a bad word, but the only treatment at that point is transplantation. And I think so many people have such a misconception about any type of organ transplant. The liver for years has been referred to as a filter. It's like an oil filter. Everything that's in your body goes through it, gets filtered out, cleaned out, recycled. Okay. I know this might sound flip, and I don't mean it to, but it's a whole lot different. If your car or truck needs an oil filter, you go to Track Auto, you go to Pep Boys, you buy one for a couple bucks. The liver is a filter to that extent, and that's where it stops. Okay. Liver transplantation is an extremely delicate, time-consuming operation. I do work with a lot of the transplant units up and down the East Coast, and I have a lot of people that I see, and you'll see from time to time, that are people that are on the list, waiting to get a transplant. They have to do certain things. There's what a lot of transplant units have that's called the golden rule. If addiction is present, you have to document 6 months of continuous sobriety, 12 months of continuous sobriety, okay, that type of thing. And they do that for a reason. A lot of times people think, well, that's just being unfair. And years ago, that might have played into it. But liver transplantation, there's such a delicate, and again with any organ transplant, it's such a delicate balance that has to be there. It's not just one fact. I can remember years and years ago, the major factor of whether a person was considered to be a successful or potential successful recipient was blood type. Well, now there's a zillion factors that have to, it's almost like a Rubik's Cube. There's a lot of ways to work it, but there's only one perfect solution. And with transplantation, you want to get as close to that perfect solution as you can. For the number of people that are on the transplant list and the number of people that are donors, we're talking light years of difference. So again, you can go to Track Auto or Pep Boys and you stand a pretty good chance of your filter's in stock. Not to sound corny about it, but if a person needs a transplant, it's a crapshoot. I've had people on the list for years and they survive long enough to get. I've had people at the top of the list nationally that died before a match was ever. So again, it's not a guarantee. Okay? We have something that I think is very unique, and we'll kind of end on this, that's bringing a lot of hope to people, especially in liver transplantation work. With kidney transplants, you can have a live donor. Somebody can give you one of theirs. Can have a lung transplant, maybe that way. With a liver transplant and a heart transplant, there are no live donors. Okay, somebody has to die for you to get that organ. Well, for years now, and it was experimental for a long time, but it's getting to be pretty mainstream now. What they can do in terms of liver transplants, you can have a live donor. And they do what's called a lobectomy. And instead of taking the entire healthy liver of the person who's died, they'll take a lobe. Because actually, if you look at the liver, it kind of looks like a lima bean that's got one segment kind of overlies. So you've got two lobes. You can take one of those healthy lobes. They used to graft it to the healthy part of the recipient's liver, and new tissue would grow and that type of thing. Now what they do is they take the lobe from the donor, they take the entire liver out for the recipient, put this segment in, and the liver is so resilient that within a couple of weeks, the person that's received that portion has pretty much a full healthy liver again. And the person who was the donor, that lobe grows back very quickly. So we're not looking at months and months and months of recovery time and that kind of thing. And it's a whole lot easier to find a match with a live donor than, again, having to wait. Plus, there's also that psychological problem that I've run into with transplant patients for years. Just that guilt. Somebody had to die for me to live. How come me? Well, the lobectomy kind of takes some of that off the table because the person that donates that lobe is around for you to thank them. So it's a whole different dynamic. But again, when we talk about this golden rule thing, in a good situation, the reason why transplant teams have this time frame and rule, a liver transplant is about an 18-hour operation. It's a huge, huge insult on the body. And I know this sounds really dumb, but if the only thing wrong with you is your liver needs to be replaced, okay, you stand a pretty good chance of surviving that. If you've got other health problems, heart problems and diabetes or other things, that all can compromise. 18 hours is a long time. In fact, most transplant teams work in tandem. They work in shifts now. Years ago, you would have one team would do the whole thing, and that's just brutal. So now they kind of shift up and swap in and out and that kind of thing, so everybody can be rested. Anyway, what we looked at today is kind of just, again, kind of a thumbnail sketch. We're talking mainly about effects of a drug of choice on the body, not late-stage addiction. Okay? If you want to look at your situation, if you happen to be in that situation like a lot of us, take these things here and multiply them times 10, 100, whatever your pattern might be. I always, even in an outpatient setting, if the person feels like they're healthy as a horse, and the only thing wrong with me is I got to get a handle on my drinking or my this, that, or the other, please do yourself a favor and have a good medical workup. Just have a good physical just to make sure. Okay, a lot of us, these are not issues, but a lot of people have been very surprised down the road when something developed, and it could have been caught sooner because they thought, well, I'm healthy and I'm fine and I stopped drinking or using. Make sure, just double check. A lot of you have had that opportunity. If you haven't, please take advantage of that and have that done. So anyway, it's good seeing everybody this evening. I always like to end these in the same way. Thanks for being here tonight. Thanks for helping me stay sober one more day. And keep up the good work. We'll see you real soon. Enjoy. Thank you.